Okay, we are back with Grazel Garcia. Really excited to speak to you again, Grazel. How are you?
I'm doing well, Scott. How are you?
Really good. And I know you've got an upcoming book launch talking about neurodiversity in therapy and couples therapy and all that kind of thing. Um, and yeah, I guess neurodiversity in therapy isn't really something that gets talked about an awful lot. So I was just wondering maybe we could have a conversation about that today, and sort of about, let's say you're an adult coming to therapy and maybe you've got ADHD and there's a concern around your therapist kind of understanding that. Is that a common concern?
I think so, yes. It's a usual occurrence, especially if the couples or the patients are not well versed in looking for a therapist with that type of specialty. So if they are matched with a therapist that doesn't know about neurodivergence, then it would be hard for a therapist to kind of help them. Yeah.
Yeah, because I guess what's the difference between a therapist who understands neurodiversity and someone who doesn't? Is it in the way they present, in the way they ask questions, in the way they relate? How does it work?
Yes, that's a great question. And all those are true. You'll know when a therapist is knowledgeable or has expertise in treating neurodiversity is they will talk about it. They'll probably name some phrases that usually other therapists who doesn't specialize in treating neurodivergent folks, they'll use some phrases such as, how long have you noticed that your brain works differently from your partner? And is this something that you both talk about? How your brains have different wirings and that you may approach situations and emotions in a different way.
Yeah, and
That's a tough tell.
yeah. So if a therapist is really going straight in there and kind of saying, okay, we understand that you think very differently to you because you have this whatever neurodivergent thing going on. So how does that interact? And I guess if you're not interacting with that regularly as a therapist, you're not necessarily going to pick up on those things. Um, if a therapist,
Absolutely.
if a therapist isn't well versed in that, what sort of assumptions might they have around a client who is neurodivergent? Like if a client comes saying, "Hey, I've got ADHD," does that immediately summon an image in a therapist's head?
So you're asking me if a client doesn't come forward with an ADHD diagnosis, how would a therapist respond to them?
More if a therapist isn't trained or experienced in neurodivergence, and they get a client and the client is neurodivergent, could the therapist have some assumptions around how that client might operate?
Absolutely. And the assumptions are all clinical assumptions, right? Like it's part of kind of our assessment and looking at what traits is the client presenting? You know, are the traits that they're presenting or they're struggling with related to anxiety, depression, trauma, or is it neurodivergence, right? Because a lot of the traits that show up in those diagnoses um, can mimic each other. They're very similar. So if the therapist is not aware of how different brains of neurodivergents work in comparison to neurotypicals, they may overlook the neurodivergence piece of it and may end up giving a diagnosis that's not fitting for the client.
Mm. Yeah, and obviously that's at best not helpful and at worst quite damaging. um, so how is therapy different when you're working with an autistic client or a client with ADHD? How do you approach that client differently to a non-neurodivergent client?
It depends. It depends on the level of the neurodivergence. Like for example, for me, I need to do careful assessment and understand if they know that they're neurodivergent. Some folks have an inkling that they are, but haven't really gotten a professional diagnosis, or formal diagnoses on it. So they're a little iffy. So depending on where they're at. So if a client comes in with less understanding about it, then I go in and provide a lot of psychoeducation. If they are aware of their neurodivergence, then I go in and look at what works for them based on pacings, sensory sensitivities, executive functioning challenges, if there are any present. I usually ask for those, and that's kind of how I cater my work based on what their difficulties are.
Mhm.
So I practically meet them where they're at and how their brain functions. There's a different way of talking to them. There's a different way of organizing their thoughts. There's a different way of pacing my therapy sessions with them in comparison to someone who's neurotypical.
Okay. And if you've got a client coming to you and maybe they're not aware they're neurodivergent, and you just get the sense like, no, I feel like there's something going on here, and you kind of explore it with them, and they start to realize, yes, there's something more going on than I realized. Do you ever recommend them to kind of get tested? Because I know you do neuropsychological testing at your practice, and I spoke to Dr. Howard a while ago about that. Is that like a recommended path that you might send people down?
Yes, if they're interested in learning more about themselves and they want more data, then yes, I recommend them to get testing if that's kind of what they're looking for. There's also an importance about being ethical about our referrals, right? Like if I don't think that the client or the patient needs testing, then, I'm very honest about it too, and we all are very honest about that. That's why Dr. Howard does a consultation first to make sure that we're giving the right information to the client. If they don't need it, then we say you don't need to spend your money on this. But if it's really something important that it's going to be helpful for accommodations and they need it in writing, and at the same time they need more data, then absolutely we're there for meeting their needs.
Yeah, yeah. And as I say, I spoke to Dr. Howard, and she laid out a lot of reasons why people might need testing and might come for testing. But it's great that you offer that in house. So the clients they're already familiar with you because it's quite a stressful thing going to get tested anyway. um,
Yeah.
um, my next question was kind of taking the cultural angle because neurodiversity in terms of how it's treated is very different from culture to culture. Um, how does that interplay enter into how you approach therapy with a neurodivergent client?
Yeah, I'm so happy you're asking that question. That's such an important question. And again, like in the work that I do, culture, and other systemic factors that may play into who we are as a person is so important to acknowledge and to look at when we're sitting with a client. Culturally, it's very different, right? So it depends on the environment that they grew up in. Like for Asian families, and I can speak to that as someone who's identifying as Asian Pacific Islander. There are many parts of our culture that um, creates a space that's geared more for neurotypicals. So, like um, uh, the discipline and I'm trying to look for the word, I don't know if it's really a preoccupation, but it's the focus that's so important to succeeding, and making sure that your memory is working pretty well. So if you have ADHD as a kid growing up in an Asian home, the way that you're reared by your Asian parents may not give you the ability to show your neurodivergence because it's not allowed. So as an adult, cut to being an adult, you may not know that you have neurodivergence because of the discipline and the way that you were reared growing up had been so different. So, cut to as an adult, you may not think that you have ADHD, but it's not void of ADHD. It's not void of neurodivergence. It will still show up in probably interactions with others.
Yeah, and then you're in the really difficult situation where maybe you constantly feel like there's something wrong with you, but you don't, you, it's so suppressed because that's just been your life up to that point. You don't even know how to talk about it. And that's where coming to therapy is just so incredible because you get to unpack that in a safe environment, which then can impact you in your wider life. Because obviously, if you're neurodivergent, how you perceive the world is very different. And just because you perceive the world in a different way, that doesn't mean other people get to treat you or choose to treat you in a way that accommodates you. Are there any kind of tricks, techniques, and anything that you do with your clients to help them manage that situation where they have ADHD, they have autism, they see the world in a particular way, but the world refuses to treat them in a way that's actually going to help them function?
Yeah. I mean, it's sad, right? Because the world that we live in caters to more of a neurotypical brain. So anyone's anyone diverging from what's considered normal or typical is usually discriminated against. So it's really difficult and it's disheartening and it's very sad. So I provide a lot of psychoeducation about that and give them a lot of skills that will help them with advocacy. We focus on speaking in a way that will help them feel confident about their neurodivergence. That works for their brain as well, right? Like I'm not forcing any neurotypical standards when I'm looking at these skills. It has to be really focused on how that person's brain works. So a lot of advocacy skills.
Yeah, and I guess building someone up in that way, allowing them to advocate for themselves and share their experience in the way that hopefully someone else is going to understand it. That means the other person is hopefully going to accommodate them a little bit more and accommodate their way of viewing the world. Is that right?
Yes, and I think the advocacy part is so important because even when you look at companies, they don't have the specific resources or the resources that they are supposed to have to be able to help folks that are neurodivergent. So it can be risky at times for neurodivergent folks to advocate for themselves. So I also help them look at, okay, what systems are we up against? Right? Like, how can we look at the systems and see what we're up against so that we can learn how to advocate based on what we're up against?
Hmm. Yeah, I mean, thinking about like neurodivergent folks in the workplace, if it's quite a small business, they probably haven't invested in any kind of training or awareness training about neurodivergency in their workplace because there's only five or six of them. Um, and yeah, I can imagine that's very difficult if you're the one neurodivergent member of the team and you're trying to tell people about this and they're just like, huh? What?
Yes, 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 you get it. You totally get it. That's usually what happens. And it's always good for clients to always look at where am I putting myself into, whether it's in a workplace or a situation, do they have resources for me? Right? Usually, companies will be able to put like job accommodations or like my practice in the career section, I specifically put that we're a neuro-inclusive practice, meaning everyone's welcome. And most of our therapists, if not all, are neurodivergent folks. So they just bring so much strengths and creativity that I think it's really important for people who doesn't know about neurodivergence to learn more about it so they can welcome other folks that have a different way of thinking.
Yeah, absolutely. I mean, it's such an important topic, and we'll be coming back to it again, I'm sure. But yeah, thank you so much again for your time today, and we'll speak again soon.
Sounds good. Thanks, Scott.